Occasionally, a patient will express a deeply held belief or objection to medical care, and as an MA, it's your role to ensure their voice is heard while staying within your professional scope. A 28-year-old woman is brought into urgent care after she was involved in a car crash, and the medical team determines that she needs a blood transfusion. However, the woman states that she has a religious objection to blood transfusions. Which of the following is the most appropriate action for a medical assistant to perform? A. Consult with the facility's chaplain about the patient's beliefs. B. Have the patient sign an against medical advice AMA form. C. Document the statement in the patient's medical record. Or D. Explain the risks of refusing the transfusion to the patient. Pause and think about the answer. The correct answer is C. Document the statement in the patient's medical record. It is within the medical assistant's scope of practice to accurately record a patient's statements. This documentation ensures the entire healthcare team is aware of the patient's wishes, respecting their autonomy and facilitating proper follow up. A is wrong because while a chaplain may be a helpful resource for the patient, it is not the medical assistant's role to initiate this consultation. B is wrong because having a patient sign an against medical advice AMA form is a task performed by a licensed provider like a physician or nurse after they have discussed the risks and benefits. And D is wrong because explaining the risks of refusing a medical procedure is part of the informed consent or refusal process, which must be performed by the licensed provider. The memory anchor for this is when in doubt, document it out. The medical assistant's role in complex patient decisions is to accurately chart the patient's statements for the licensed providers to act on. When you're a medical assistant, remember that you are the eyes and ears of the clinical team. Accurate charting is the most powerful tool you have to protect your patient's rights and safety. Come learn more at mangostudy.com.